both the government and the public sector, the private sector have all come together saying, let's formulate methodologies to handle this problem. Let's work together to see how we can tackle the problem, and let's learn from each other. And I think that's the way the industry has come together. In terms of infrastructure, if it's a full-blown issue, if we extrapolate data, which we're getting, global data, we could have a problem. But I think the norms and the measures which have been put into the country are simply, the awareness. We're talking about social distancing. We're talking about this 21-day lockdown. I think all this is going to make a huge difference in flattening the curve. The industry per se, in hindsight, maybe it could, we could have helped it grow much more. And that in a way comes with a sense of regret, that if healthcare industry had really been given the infrastructure status, Indian healthcare as an industry, as a sector, is so much more prepared with all the constraints they have than many other countries who had everything. So I would give, on a scale of 10, Indian healthcare industry at least an 8 for the way they're coming together and coping with this. And at this point, I'd also like to say that the government support from the health departments of the states, of the center, Niti Aayog, has been tremendous. Maybe we could be more prepared with materials within our system. My biggest concern or worry is probably the fact that we're not able to test enough, extremely well. The government took a call to scan visitors while coming in. Very well done. Took a call for a lockdown. Very well done. Are people educated enough to handle the problem? Not enough. People need to know that it's their problem and not the government's problem. And I think that communication could be stepped up so much more. But going forward, the huge realization has dawned on all of us that a stable economy needs a stable healthcare backbone. And healthcare as such needs to be frankly looked after and nurtured. Because at the end of the day, they're the heroes who really stepped in. Gods in white coats is what they were called. But are we doing enough to develop a healthcare system for the future? Can we fast track that thought process without this huge cloud of suspicion on private sector healthcare? Would really, really make a big difference. And if we can get it back on its feet, because right now the threat of shutting down looms very large, very high and very large on our radar. So can we do something to really look after the industry so that it gets back quickly on its feet? Because otherwise we can't serve the nation. And also we must remember that 70 to 80% of India's healthcare is in the private sector. You cannot allow that tree to die. The public, number one, should not panic. The public has to trust the private sector healthcare, has to trust the government sector healthcare, and say that, they're here to help and to look after us. Appeal to them is that, please communicate the right things to do, because people look up to the healthcare fraternity, whether it's the doctors or the nurses or the support staff. And if somebody working in healthcare says something, people will listen. So please communicate the right things. Please rise to the challenge of looking after people in our nation. Please look after the vulnerable population, because they need extra care and extra TLC.